All right, good evening, everyone.
Hey, good evening.
My name is John, and I'm going to be talking to you guys about CPR. CPR is a life-saving intervention, and if we intervene, we could actually save a life. I'm going to give you a couple of facts about CPR. Number one, CPR is the foundation of all advanced life support interventions. Anything that you see people do on an ambulance or in an emergency room in the hospital, all those advanced interventions don't work unless we're doing good CPR before. Sudden cardiac arrest remains the leading cause of death in the United States. Those two facts come to us from the American Heart Association's CPR Basic Life Support training manuals. 70% of all cardiac arrests happen outside of the hospital. They happen in the home. That also comes to us from the CPR training manuals, but it also comes to us from the 2015 Basic Life Support CPR Update Guidelines. And 500,000 deaths a year in the United States between adults and children. That's a fact that comes to us from the 2015 CPR guidelines, but part of the education component. So that's a separate source for us, giving us the information. So here we go. So the objectives today, we're going to talk about what is CPR. We want to know when we want to do it. We want to know when to stop, and what do we do after we've gotten training? What's next? So basically, what is CPR? CPR is a life-saving intervention for people who have gone into cardiac arrest. That's anybody who is unresponsive, someone who is not breathing normally, and someone who has no pulse. So components of CPR are making sure that the area is safe for you to approach before you try to help them. You want to make sure that they're awake or responsive, so you would check responsiveness. You could then call 911 or shout for help until someone comes to assist you. You then begin CPR by doing the chest compression components, and then something that's taught to the professional rescuers are the ventilation components. We don't teach that out of hospital, so lay providers are expected to do just chest compressions. High quality CPR is actually the foundation of all advanced resuscitation efforts. So the practice component, I'm going to do a demo of the actual procedure, and then I'll let you guys kind of give a practice run. And for our practice purposes, before I approach, I want to make sure that the area is safe. So once I'm sure the area is relatively safe, I approach the person, I'll tap, are you okay, are you okay? If they don't respond to me, I'm going to look, I'm going to say, hey, call 911. Come back, or if no one's around, help, help, really loud until I get someone's attention. If they're wearing a shirt, I may lift the shirt or open their shirt, exposing their chest. The center of their chest, between the nipple line, I'm going to place my palms and interlock my fingers. I want to make sure that my wrist and my shoulders are in alignment. I can do it this way, or this way if I have problems with my wrist. Then I want to bounce at the waist, and I'm going to do a rate of about 100 per minute. I want to compress deep enough. Some people are worried about breaking ribs or breaking bones. Broken bones heal. Dead, not so much. So if you go too shallow, you're not going to be doing much of intervention. So I want to invite you guys to kind of give that a try. So as you approach, what are the things that you want to look for?
Make sure the scene is clear.
Excellent. And then you're going to?
Make sure everything's okay.
Nice.
Hey, you okay? You okay?
Okay.
There's no response.
No response. Call for help.
Call for 911.
Go call 911 and come back.
Right.
Or help.
Help.
Right.
And then we're going to expose.
Expose the chest.
Nice.
Line up between the nipple, right in the center, and forward.
How long do we do this?
Nice. We'll get to that in a second. Grab a
There you
seat.
go.
Thank you. So when do you do this is we establish unresponsiveness. So a patient doesn't respond to you when you tap and shout. We also don't notice normal breathing. We don't notice purposeful movement. Those are signs that there is no pulse, versus when someone is doing purposeful movement, if you touch them and they're able to push your hand away, even if their eyes are closed, that's purposeful movement. So that means that they likely have good perfusion to their brain. Examples of abnormal breathing are like a fish out of water when they're gasping. And then there's a long pause. That's not normal breathing. Assume they don't have a pulse, start CPR. So to your question, when do we stop? So basically we're gonna do this until either police, fire, EMS, or other trained responder comes and takes over from us and indicates that they're gonna take over. Very rarely if the patient wakes up and says stop. That's a great indicator that they have good perfusion to their brain, right? I've been doing this for about 23 years, 18 of them as a paramedic, and I've only had one person wake up in the middle from having a CPR done to them. So what do you do now? What next? Practice. This is something that you can practice at home. If you have a rather firm couch pillow, you can actually do your compressions on a table or something and just practice this. You can also train your loved ones, teach them what you've learned. All right, you could share this with family, friends, anyone that you work with. You just might wind up training your own rescuer. As I mentioned before, 70% of the out-of-hospital cardiac arrests happen at home, so we're likely going to have to do this. If we ever do, we're going to have to do this on a person that we know. And that's the end of my presentation. I want to thank you for your time and your attention.
Thank you
Appreciate it.
for teaching us.
And that's it.